Welcome to part 2 of our series on myopericarditis, where we focus on symptoms and treatment. This channel is for educational purposes and does not provide medical advice. A big thank you to all our subscribers. Please remember to like, share and subscribe. Now, have you ever wondered what myopericarditis is and how it affects the body? This is a condition where both the pericardium, the sac-like structure around the heart, and the myocardium, the muscular layer of the heart wall, become inflamed. Now let's delve into the symptoms. They can vary widely, with common ones being chest pain, which may either be sharp and worsen with inspiration or coughing, or more continuous and tight. Other symptoms can include shortness of breath, fever, palpitations, lightheadedness, and fatigue. In cases where heart failure is present, you might find additional features like breathlessness when lying flat and peripheral edema. Diagnosis, on the other hand, is a bit more complex. It involves a combination of clinical history, physical examination findings, and various diagnostic tests. A history of recent infection followed by suggestive symptoms often gives a clue. On physical examination, findings can include a pericardial friction rub, muffled heart sounds, hypertension, and distended jugular veins. Diagnostic tests might involve electrocardiograms, laboratory investigations, and imaging options. Electrocardiogram findings typically include T-wave inversions, saddle-shaped ST segments across multiple leads, and sometimes PR depression. Laboratory investigations can involve cardiac biomarkers such as troponin and elevated inflammatory markers like CRP and white blood cell count. Imaging options can include chest X-rays, echocardiography, and MRI scans. The treatment for myopericarditis varies and depends on whether the pericardium or myocardium is primarily involved. In cases with predominantly pericardial involvement, aspirin or non-steroidal anti-inflammatory drugs can be used to manage pain. Colchicine is often added to reduce the risk of further episodes. Antibiotics are prescribed if a bacterial infection is the cause. In severe cases, excess fluid in the pericardium may need to be drained or the pericardium removed. In cases with predominant myocardial involvement, NSAIDs are used in low doses as higher doses can worsen myocardial function. Steroids may be employed, particularly for immune-related causes or recurrent episodes. Medications like ACE inhibitors, angiotensin receptor blockers, beta blockers, and diuretics are utilized when left ventricular function is impaired. So, to summarize, myopericarditis is an inflammation of both the pericardium and the myocardium. Its symptoms can vary widely, and diagnosis involves a combination of clinical history, physical examination, and various diagnostic tests. Treatment depends on the extent of inflammation and the patient's clinical situation. Be sure to consult with a healthcare professional if you suspect you or someone else might have myopericarditis.